You mentioned mood disorders and issues. Depression is one where I'm curious if there's a causal link, or is it simply that chronic pain gets depressing, or a biological link, or the other one I would throw in is medication. Can medication also create depression?
I think it's all of those things together. You've mentioned a lot of potential reasons why depression and migraine may be linked. And I mentioned earlier on that mood disorders are highly comorbid with migraine, and migraine, it goes in both directions. So migraine is more common in people with depression, about 2.5 to 3 times more common, but depression is also more common in people with migraine. And the question of which comes first, the pain or the depression, is something that gets discussed a lot in headache medicine. There are people who believe pretty firmly that being depressed causes migraines, but many of us also really recognize that being in chronic pain all the time can be really challenging to cope with, and that chronic migraine itself may contribute to the development of depression. It's not clear if there's a biological link, but the fact that some antidepressants are effective for migraine might support that idea. Both may involve dysfunction of the serotonin and noradrenaline pathways. That's why I think the SNRI class of antidepressants is more effective for migraine than the SSRIs. I do think it's quite complicated, and we have not completely worked out all of these links. But I also want to come back to what you were saying about medication, because we do tend to treat migraine with a lot of medications, and medications can have side effects. And one of the side effects of some of the medications we use is mood issues. So commonly used things like topiramate and the other anti-epileptics rather, and potentially some of the beta blockers and other medications have been associated potentially with mood changes. So that's always something to be aware of as well.